So up next, we have Dawn Falkman as we go from east to west from in Bedford and Somerset counties, Developmental Behavioral Health Services. So Dawn, you are up.
Hi, good afternoon, everyone. So my name is Dawn Fuffman. I am the Student Assistance Liaison Coordinator for Somerset County. I apologize, I can't get my camera to work, so I'm not sure what the deal is with that.
Yeah, I was looking all over for you.
Yeah, so I'm sorry. So the first slide that you see is the DBHS. That is the county part of our agency. And Julie Huffman is my counterpart in Bedford County. So we're Bedford, Somerset, Developmental and Behavioral Health Services. We cover 2 counties, but we're still one big agency. So that's why you'll see 2 different slides here with that. So that just kind of shows you where we're at. In Bedford and Somerset, we're right next to each other. And we pretty much do everything similar. Julie and I are in contact quite a bit. So the county positions that are under the DBHS are case management, administrative case management. In Somerset County, we just have 1. Our county's pretty small, as well as Bedford. CASP falls under the county positions. We have 1 CASP coordinator. Again, student assistance program, there's 1 for each county. Crisis intervention falls under the county positions as well. And then the medical records falls in there at the same time. So the next slide, if we could, I'm sorry. Okay, is Cornerstone. Cornerstone, then we used to back up just a wee little bit, we used to be just Bedford, Somerset, MHID. And then the state came in and said, okay, it's time you guys need to separate. So we needed to separate the county entities from the provider. Even though we're still under 1 building, we're still under 1 umbrella, we still had to make 2 different names. So it's a wee bit confusing, possibly, but we were, I think, one of the last of the Mohicans to kind of move in separating the names. So the Cornerstone Community Service is the provider system of DBHS. The next slide, please. So this is who Cornerstone is. It goes on to explain that they are the provider system associated with the Bedford Somerset DBHS, Developmental and Behavioral Health Services. They have been there nearly 50 years of providing experience to the communities, being a leader in providing behavioral health services to children, adolescents, adults, and seniors. Our professional staff offer individualized care and confidential treatment to help individuals reach their recovery goals. And they are very flexible in meeting the needs of those they serve. So they have some non-traditional hours. They have evening hours that they'll do. They'll go out in the community if they absolutely have to make things work. So they're pretty flexible as far as the system goes with the Cornerstone provider system. This is the mission. Their mission is to assure that services are high quality, cost effective, timely, and accessible. We promote family-centered services in our early intervention program, recovery and resiliency in our mental health program, and self-determination in our intellectual disabilities program. That is also a separate part of Cornerstone. I don't have that in the presentation just because I'm not super familiar with the ID side of things. So I didn't include that. And then there's our vision if you wanted to look at that quickly. And then Cornerstone Community Services offers 6 different levels of care to help meet the individual needs. So in the building that we have, we serve the population for outpatient psychiatric and therapy services. There are 3 psychiatrists in the building at different times, as well as they do telepsych. They have, I think there's 8 therapists that are back there. Crisis intervention falls under this too. Even though it's a county entity, they are, again, in the same building. So crisis, there's a crisis worker in the building at all times. So GCC can come grab them, or the nurse can come grab them, or the doctor, whoever, if they need immediate assistance. We also have psych rehab services. Case management services, we have blended case management as well as, like I said, the administrative case management positions. They have supportive housing services. And then the group counseling center, the adult partial hospitalization program is housed in the county building as well. So for the student assistance program for Somerset County, I'll talk about that because that's my part and my baby. So again, I'm the only liaison in the county. So we have 12 public schools in our area. We don't have any charter schools. And one of the schools is the technology center. And then also involved with the public schools, excluding the technology center, we have a school-based therapist in every one of those buildings. So as a liaison, I can use them as a referral source easily. We also have around 6 to 8 children and youth workers that are trained and sit on our teams. And the reason that we have that, just to expand a little bit, is the schools used to get very frustrated with children and youth, and there used to be a lot of I guess negative talk around, why can't they do this? Why can't they do that? A lot of phone calls, to the agency that probably could have been answered if we had someone at the table. So I approached children and youth a few years ago and asked if we could have some of those folks sit around the table. And it has helped largely. It kind of gives the school a sense of ease when the schools have questions or concerns with students. It gives the school district themselves their own contact, and that seems to be helpful for them. It has seemed to have lowered the maybe unnecessary calls or reports to the school when they can at least call that contact person at Children and Youth and say, hey, this is what we have. Is this reportable, or is this something we're just kind of overthinking? And I think that it really has lessened a lot of unnecessary calls that they've had in the past. So we continue every year, as they have a high turnover too. We continue every year to try to get new people trained with children and youth. So then we have 18 secondary SAP teams in Somerset County and 11 elementary teams. So I don't get to all of them every single week. I have to kind of flip-flop schools so that I can get to each one of them, but we do get there. We are very rural, and very rural, I mean, like, there are still areas that we don't have cell service for. Internet is very spotty. Some of our schools are still kind of real coveting of their passwords. So if that right person's not at the school at the time I need to use, like, the BH Works, I don't get to use that. So we're still working on that very, very hard. Eventually, hopefully they'll trust, but we're just so relatively new to this. And to keep in mind too, when you see our numbers, our schools are very small. We graduate anywhere from 21 students. I think that was our smallest school this year, to 47, which is our largest. So our school districts are not very big. And then we have the drug and alcohol liaisons. We have 2 of them currently in Somerset County and 1 in Bedford County. And I do complete SAP assessments. And then I also make the recommendations and referrals in Somerset County. So for Bedford County, Julie Huffman, like I said again at the beginning, is the liaison there in Bedford. They have 1 drug and alcohol liaison that, again, is not, as Tita has, not using BH Works, but hopefully we'll get them on board with that. The school districts that Julie services is, there's 1 charter school and 5 public schools in the district, with 5 elementary teams and 5 secondary teams as well. Again, they are very rural. I'm not sure what the numbers are as far as, like, what they graduate. They are probably around the same as us, other than maybe one of her schools that might be a little larger. And then Julie also completes SAP assessments and makes the recommendations and referrals in her county. And then here's the drug and alcohol providers. Single county authority is who Somerset County uses. So there's two of them. They split the county up with me, and their information is on the left side of the screen. And then Julie's, the Bedford County, was on the right side. And as far as the BH Works implements goes, we were a small pilot in May of 17. So we kind of jumped on at the end and started in June of 2018 through the grant. Our agency just bought this for this last school year. So we now get to use it every year, and hopefully they continue to do that every year. So through May of 2020 of this year, we had in Somerset 53 students who were screened by the BH Works and 19 who were not screened. And in Bedford, there were 14 screened and 5 were not screened. So again, some of the reasons for the ones that were not screened either fell in the age range where they were too young for me to do that. And I don't have the elementary yet, but I'm working on that to get that done. So I'm excited to see how that works out. Internet connection, again, has been a big one in the past. And then I just have some that are just plain refusals. Some of the high school kids, it's almost like, look, you have to do a SAP assessment or you get out of school suspension type thing. So they'll do my paper face-to-face, but they don't want to do anything on the iPad. So we're getting there. It's a slow process, but we're certainly getting there. As far as the feedback goes from Julie and I both, I think that we both agree that, we're both still learning on all levels of this tool. Poor Tita has had more calls probably at the beginning, God love his heart, than ever. But I do love using it. I think that it gives such a great snapshot and honest responses from, having to ask is hard to approach questions to students. Schools were rather accepting of it. As soon as you said suicide prevention tool, they were all about it. So again, just trying to sell it to the students to do is something that we have to, continue to work on. And I think depending on, like I said, whether they were willing to meet with me or not, depends on whether they're, doing the tool. I think more and more students, the more they talk to each other about it, I think the easier they'll feel in creating something like that. And then the next slide, I think, is just kind of the summary. Again, when I first started with it, it wasn't difficult to get students on board. It was just a matter of if they were going to be honest and if they were willing to do that part of it. I always do that at the beginning, and then I let them answer some of my questions that I have on my own from our agency while I read the summary of it. So that's very helpful. Again, it helps to answer or ask those very difficult questions. It's a great summary when you're talking to the parents. I feel like I am mirroring what other people have said, but certainly it's wonderful. And then JQRS reporting, it is great for that. I have had to still hand count some with the ones that refuse or the younger students that I've had, but basically it's been pretty wonderful. And this is just my shameless plug for POSAP. So I try to get our schools on board with joining POSAP. So I kind of just give them the teasers. Like with the next slide, it gives you resources for schools. This was just all of the free webinars that we as a board provided this past year. If you're a member, you can see them. They're archived. You can see certain things from our state conference that happens every February. It kind of gives resources. You can just click on some of those. And it's just a wonderful link to a lot of things that all of us are dealing with. So that's kind of my shameless plug for POSAP. So again, just the last one gives my information. I sit on the board of directors for POSAP, again, for the last 9 or 10 years, I think. So if you have any questions or comments, any helpful hints for me, I would greatly appreciate hearing those. as well as Julie. There's Julie's information too. So yeah, if there's anything that I can answer, any questions, just let me know. And thank you.